Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Sciences, Coimbatore. Today's topic is on acid-base balance. A case study. A 50-year-old male patient was admitted to an emergency with an complaints of vomiting, dizziness, fainting for the past 1 day. He has a history of smoking and has shortness of breath. On examination, he has a respiratory acidosis. So, before going for respiratory acidosis, what is actually acid-base balance and how they determine it is an acid-base balance? Let us see further. Acids are the substance that dissociate or lose the ions. Base are the substance that accept the ions. Actually, what is that ion? It is an H plus ions. What is buffer? It is a substance that reacts with any form of acid or base to maintain the homeostasis of our body. So the normal pH will be 7. To regulate the acid-base balance, our body produces these 3 mechanisms. The first one is buffering mechanism, the second one is respiratory compensatory mechanism, and metabolic or renal compensatory mechanism. So acid-base balance buffer is a solution that contains 2 or more chemical components that prevent the marked change of H plus ions. So the main person here is an H plus ion, where it is lost or it is gained, that depends. Bicarbonate buffer system occurs in our body and extracellular and intracellular fluid. So this, what mechanism it does is, it maintains the CO2 level and maintains the bicarbonate level. So this process done with the help of carbonic anhydrase enzyme. So H2CO3 will be dissociated into H2O and CO2. This CO2 will be reabsorbed and it will be excreted through the lungs. Phosphate is one form of an electrolyte which is present in our body in intracellular fluid. Here there are 2 phosphate we are talking about. One is dihydrogen phosphate, another one is hydrogen phosphate. Dihydrogen phosphate is an acid, hydrogen phosphate is a base. Why so? Because dihydrogen means 2 hydrogens. So excessive hydrogen says it is an acid. So protein buffer system, here the protein we are talking about is an hemoglobin which is present in an RBC. Almost 700 gram of hemoglobin is present in the patient blood. And this plays a major role in removal of carbon dioxide and providing oxygen to the tissues. Through respiratory mechanism, what we are going to see is how lungs protect us from acid-base balance. So this process helps by elimination of the carbon dioxide and intake of the oxygen. This makes a change in the H plus ions. Peripheral chemoreceptors are most prominently acting than the central chemoreceptors. Why? Because the hydrogen ions cannot cross the blood-brain barrier. Renal system also a long-term system which helps for the maintenance of acid-base balance. The process is done by reabsorption of filtered bicarbonate, generation of new bicarbonate, and excretion of the H plus ions and urine acidification. As low as pH of urine is 5.0. Note that the urine is an acidic one. So now how to determine the acid-base balance, how to test that one? It is through the blood test that you can take via radial artery, femoral artery, or through the procedure means you can take via arterial line also. What is the purpose of taking the test is to identify the critically ill patients with respiratory distress or metabolic distress or electrolyte imbalance. The equipment needed for maintaining this ABG is gloves, heparinized saline, heparinized syringe, dry cotton, alcohol wipe or gel, tape, pillow or blanket to rest the waist during sampling, so that the patient hand should be in a supine position, a plastic bunk, a local anesthesia of 1% of lidocaine, and 23 gauge needle and patient label. What precaution that you have to take is, you should not make the patient to have pain or anxiety during this technique, so that the hyperventilation will be occurring, that will reverse the result of acid-base disorder. And you want to maintain the partial pressure of carbon dioxide level by giving the supine position rest to the patient. And the patient should not clench his finger too. So what that report says, what will be there in that report is, it has a partial pressure of oxygen, oxygen saturation, partial pressure of carbon dioxide, bicarbonate level and pH level. So what is pH? It is in status of our acid-base balance. how our body maintains this acid-base levels equilibrium is called as pH. So the normal pH of a blood is 7.40. What is partial pressure of carbon dioxide is the amount of carbon dioxide that is present in the blood after expiration. So the partial pressure of carbon dioxide in the blood will be 10% in the plasma, and it is carried over by the RBC in case of 90%. So once your carbon dioxide is increased in your body, what will happen is your breathing will be high stimulated, the information is going to brain, the ventilation will be decreased. So once the ventilation is further decreased, so the patient will enter into coma. What is bicarbonate and CO2 content, and what is O2 content presence? As bicarbonate is a base, and the CO2 and bicarbonate has a relationship like total CO2 is equal to bicarbonate plus dissolved CO2. So they have a ratio of 20:1 in plasma. That is, for one acid, they need a 20 base to neutralize it. And oxygen content is the amount of oxygen which is carried by the hemoglobin for the transportation to the tissues. So the formula for that is oxygen content is equal to oxygen saturation into hemoglobin into 1.34 plus partial pressure of oxygen into 0.003. What is partial pressure of O2 and O2 saturation is it? The saturation is amount of the oxygen which the hemoglobin have is 92 to 100%. If the saturation comes below, that is called as tissue inadequate perfusion. Finally, what could be a result and a normal value is the pH is 7.35 to 7.45 in case of ABG, and partial pressure of oxygen is 75 to 100, partial pressure of carbon dioxide is 35 to 45, base excess is 0, and oxygen saturation is 90 to 100%, and bicarbonate level will be 22 to 28 milliequivalent per liter. That will be a slight change in the venous blood because of deoxygenated content which is present on the blood, so that the carbon dioxide level will be drastically reduced and the oxygen level also will be reduced. So summary of this topic, what we have seen is empathy in part. That means we have seen about the case study. For the case study of the patient, what is acid-base balance has been given. For definition and define, we have seen about what is acid-base balance and what are the regulatory factors. So how to test this one is an ideation, that is called as determination of ABG. And in prototype testing, we have seen the normal values of ABG. And in evolve, you know this normal value, then what? Then we have to check whether this value has an increased or decreased, or further changes can be analyzed for the disorder identification. Thank you for listening.